I'm George Herzlinger. I'm the president of Belmont Instrument Corporation. We're located in Billerica, and we developed and manufacture and sell medical devices. This is one of our lead products. It's called the Belmont Rapid Infuser. It's sometimes called the FMS 2000, and it's for massive transfusion of blood for patients who have lost a lot of blood, either due to severe hemorrhage in either trauma or in military combat, or in a surgery in the hospital. This is our electromagnetic heat exchanger, and there's an electromagnetic coil around here, and there's a ferrite piece to trap the electromagnetic field. There's another piece on the door, and there are 16 stainless steel rings, and the rings get warm from the varying magnetic field, and the flow is the pumps the fluid through the rings in between these channels in semicircles, and it warms the blood. And the pump is here in the corner here, and it's very simple. The rollers and the plate can kind of line up, and you simply close the door to engage it. And then we measure temperature at the input through a very thin window in this disposable set, and we measure the output temperature in a similar thin window. So this machine pumps and warms, and then we also detect for air. There's an air detector in here that tells us that we're running out of fluid, and there's an air detector here that makes sure there's no air going to come into the patient. So it's just simply a matter of closing the door, and it's ready to run. We are running this at a fairly low rate. It's 120 ml per minute. It's not terribly low, but it's the machine will go much higher. And as we start running it, the machine will start warming the fluid, and this is the readout is in degrees centigrade, so it will not read 98.6, which you're used to. Normal body temperature in centigrade is 37 degrees C. This will be just above it to give it some extra warmth, so that if it cools a little in the line, we're still going into the body right around body temperature. The other controls are to increase and decrease the infusion rate, which we do precisely. And if you want to stop the machine in a hurry, you just push stop. So it's pretty simple. The relevancy of the Olympics is our Canadian distributor was contacted by the representative from the Olympic Committee that they would like to have one of our rapid infusers at the mobile hospital for the Winter Olympics at Whistler in British Columbia. It's not connected with a particular event. It's really just in case something untoward happens and somebody really needs to be treated in an emergency for massive bleeding. And so I'd imagine that the hope is it'll never have to be used.